regards to that. So the big thing with functional medicine is chronic disease. Chronic disease is one of the leading cause of death and disability. So we can see here the prevalence in chronic disease is 1 in 2 Americans have some type of chronic diagnosis. Okay, deaths, 7 out of 10 deaths are related to chronic disease. ADLs, that's your activity of daily living. A quarter of Americans have 1 or more diagnosis of chronic disease that limits their activities of daily living. Arthritis, which we know is a chronic disease, typically autoimmune driven, is one of the leading causes of disability. We know that obesity directly impacts our health and our function to be healthy. 1 in 3 adults are obese and 1 in 5 youth are obese. So clearly we have a rampant amount of chronic disease in our society. And if we can manage our chronic disease first, we're heading in the right direction. There's another step after we manage chronic disease, which I'm going to talk about in just a couple minutes here. So this study here shows, again, the prevalence of chronic disease. So our first 3 lines here, we can see the bar, right? The number of deaths, basically over time. We can see as time goes on, our numbers of death in what I would consider related to chronic disease: cancer, ischemic heart disease, so basically heart attack, and cerebrovascular disease, which again is basically think brain attack, heart attack, brain attack. These 3 are our biggest contributors to death, which in my opinion, and most medical providers will tell you this is related to chronic disease. Yes, there can be some genetic predisposition to these conditions, but with healthy lifestyles and taking care of your body, these can be prevented, okay? So again, this study here was to just show and kind of drill home the fact that our biggest risk, our biggest cause of death is related to chronic disease. And as we can see, we are not slowing it down. It is steadily increasing as life expectancy goes on. Okay? And then the other ones, again, these would be more acute issues, right? Acute respiratory infections, perinatal conditions, HIV, AIDS, accidents, tuberculosis, malaria. Those are more acute symptoms. Okay, but we talked about chronic disease. And I mentioned, well, if we can take care of chronic disease first, that's great. But what about healthy aging? It's great if we can ward off that chronic issue. But once we establish and we take care of that chronic issue, how do we age healthily? How do we have health span versus lifespan? That's the big thing. That's really at my root what I want to help. Great if I can get you better, if I can get your symptoms resolved, that's great. I'm happy. I always am never settled for more. And that's my biggest enemy, but my best friend. We get you better, but I want more. I want healthy aging. I want lifespan versus health span. And this is kind of a stat that I was able to pull that kind of talks about that. So I know there's a lot of words on here, and I'm going to just break it down very simple. So life expectancy has increased more than 6 years between 2000 and 2019. Great. So we are increasing our lifespan. That's good. But our HALE, which is your healthy life expectancy, they termed it as HALE is only going up 5.4 years. So it's not keeping pace with our 6 years. So our health span, our lifespan is going up, but it's not matching our health span. So we are not aging healthily. As we start to age, we have more issues. We are not as healthy as we should be in regards to our lifespan. Does that make sense? I know it's a little bit convoluted, but just know as we age, our health is not matching with our increased age expectancy. Okay? So again, goes back to great, we can take care of that chronic disease, but we want you to be healthy in those golden years, right? It's great if we can, we can be alive, but we want to be cognitively present. We want to have our memory. We want to be able to connect with others and have meaningful conversations and be able to remember those conversations. We don't want to be, stuck in a chair and, being spoon-fed soup all day, right? So that's kind of the big piece with functional medicine. I want your best years, your golden years, I want you to be as cognitively healthy as possible. Physically, is that going? It's tough to literally reverse the clock. Physically, there might be some issues, but mentally, cognitively, I always tell my patients, I want to treat you how I'd want to be treated. And maybe this is me projecting. I tell my wife, if I'm in a wheelchair when I'm 90 years old, I'm okay. As long as I can have an intellectual conversation with my great-grandchildren and understand what's going on and connect with them in a meaningful way. So basically, I want to be cognitively there. I do not want to have dementia. I do not want to have cerebrovascular function. I do not want to have Alzheimer's where I'm just, that's great-grandpa Ross in the corner. Just say hi and acknowledge him, and that's it. Right? We should not want to live like that. So, again, lifespan versus health span. We take care of that chronic disease, great. Now let's move on to health span. Let's make sure those golden years you're as healthy as you possibly can be. And I love this quote. I came across a research study and they said, years are being added to our lives. Life is not being added to our years. Really, really powerful when you think about that. The extra years are being added at the very end of our lives, but they are poor quality years. Grandpa Ross is in the corner. Just say hi to him, acknowledge him. He doesn't really know what's going on. I don't want that for anyone. So again, my goal, yes, I want to get you over your chronic disease. I want you as healthy as you can be in those golden years. So this is just another chart. Again, Dr. Ross, driving home the point, as always. So this is basically a chart. In 2011, they ran a study, about 12,000 individuals out of Wales and England. And it was various ages here. You can see the age line here. So they basically gave them a questionnaire with a boatload of questions that indicated their health and how they perceive their health, okay? And as you can see here, as they were younger in age, we had low percentages of perceived disability with higher percentages of what was perceived as good health depending how they filled out these questionnaires, okay? And as we can see a direct correlation as age starts to go, our disability, perceived disability comes up, and our perceived good health goes down. Again, driving home the fact that we are lifespan, right? Health span. Health span is going down as we start to age. Where we want to see this curve start coming up, we want to see this curve start going down, right? As we age, we want to see in your 75, 84, 85 plus years, I still want to see my patients perceiving and reporting good health. I don't want them down here. Okay? Or I don't want this to continue to come up. So again, just driving home the fact that as a whole, as we age, our health span goes down. Great, our lifespan's doing great. A lot of people would probably say if I can get 85 plus, I'm happy, but I don't want you up here for your disability. I want you down here, right? And then your good health up. So again, just driving home the fact of health span, not lifespan. So We talked about the whole purpose of chronic disease and the focus of health span rather than lifespan. So what is functional medicine? I'll give you the big fancy term here that we described functional medicine. Functional medicine is a science-based, personalized healthcare approach that assesses and treats underlying cause of illness through individual tailored therapies to help restore and improve function. Lots of words for saying, let's stop treating the leaves in the branches, right? Cancer, insomnia, thyroid disease, arthritis, depression, diabetes, high blood pressure, and let's get down to the root. What is causing the presentation of how this tree looks or how decrepit this tree looks, right? So that's really the base of functional medicine. Let's not give you a pill for an ill. Let's not cover up the symptom with a Band-Aid, right? I always say to my patients, we're not going to put a Band-Aid over a bullet hole. It just doesn't make sense. We're going to get to the root cause issue, address the root cause issue, so now that if we fix the roots, we can now have this beautiful, flourishing, fully healthy tree. And that's really the basis of functional medicine, getting to the root cause issue. Okay, so compare and contrast. So first, let me say, if I fall and I break my arm or I get into an accident, if I fall off the stage, which it could happen today, but I break my arm, I want to go to the hospital. I want my arm reset, okay? I want it casted so it heals appropriately. So conventional medicine has its place, okay? In chronic disease, I believe it does not, okay? I believe they want to try, right? The whole aspect of 95% of it, they're coming from a good place, right? There's always those outliers that stand out. But in chronic disease, conventional medicine has failed. I wouldn't have a profession if it didn't, okay? So I feel confident in saying that. But again, I break my arm, I somehow get some catastrophic injury, I want to go to conventional medicine, okay? But in chronic disease, I want a functional medicine provider. I want someone who's going to get to the root cause of where this chronic disease developed from and how we address it from the root rather than putting a Band-Aid on a bullet hole, okay? So, conventional medicine, disease-oriented. Again, the pill for an ill, okay? Doctor-centered, meaning it's all about the doctor. It's about the doctor coming in, sitting down with you for 30 seconds and writing you a script, doesn't want to answer questions, does not want to be bothered with any questions. It's not the doctor's fault, which we're going to get to in a second. It's the demands from the insurance companies that are being put on that doctor so that they can keep their door open, okay? So it's not the doctor's fault. They're trying to keep their door open, but unfortunately they can't give you the care that you deserve and you need because they're under the insurance-based model, which insurance dictates how they are treating the patients, okay? So it's doctor-centered. Everyone is treated the same, so it's kind of like a cookie-cutter model, right? Not any single one of you are the same to the next person you're sitting next to. As how much in blood you might be, you are not identical, unless you're identical twin, then you got me. But there is no set plan. Every person is different. Every person should be treated that way with an own individualized, personalized care plan. It's specialized, meaning you go to audiologist. Hey, I have this skin condition. Okay, you go to the dermatologist. Hey, my hormones are off. Okay, you go to the endocrinologist. Hey, doc, I think I have some RA issue. You go to the rheumatologist. Hey, doc, I think I have, it's ologist. It's all specialized medicine. And then, of course, the more ologists you add in, the more it is playing, telephone message down the line, right? By the time it goes down to 30 people, you could have said the red to start, and it comes out, yeah, or worse, like house. Where did that come from? So again, it's specialized medicine, okay? Diagnosis-based, right? Name it, blame it, and try to tame it, right? That's not what we're trying to do. Symptom-based, right? And early detection of disease. So I don't necessarily, I don't agree with that one, right? So that kind of ties, just erase that one. I don't agree with that one. But let's go over functional medicine. Health-oriented, right? We're not disease-oriented. Again, we go back to, we want health span, not lifespan, okay? Patient-centered. You are the most important thing. Most important thing, patients always come first. I will swallow my pride, and if it's what my patient wants, as long as they're safe, that's what matters. Holistic. So we're looking at the whole body. We're not looking into broken systems. We're not looking into pieces. Everything's connected. Your hormones are connected to your adrenal function, which are connected to your joint pain, which are connected to your gut, which is connected to your brain, which is connected to your neurology. It's all tied together. It's a spider web, right? We strum one string on the spider web, the whole thing moves. Looking at the underlying cause of disease, right? So we're trying to find out what's going on. Biochemical individuality. Again, each person is different. They need to be treated that way. And a preventative approach. Okay, so this is early detection. Basically, so they're basically saying here, when you have the disease, we're going to treat you. Okay? In conventional medicine, when we have the disease, we're going to treat you. Preventative approach. So technically 6.4 or greater of a hemoglobin A1C is considered diabetes. So conventional medicine, you have 6.4, now we can treat you for diabetes. I have someone come in, they have a 5.9 hemoglobin A1C in their diabetes. Hey, we're in pre-diabetes. We're heading to risk for diabetes. We're going to treat you now. Conventional medicine, no, we're going to wait till you hit that number before we treat you. Okay? So that's the comparison there. Okay, priorities in functional medicine. These are kind of like the pillars of functional medicine and how we approach this. So assimilation, very easily what this means, digestion, absorption, and we look for imbalances, microbial imbalances. So this is basically, we're looking at the gut, okay? Defense and repair. So we're looking at the immune system and inflammation, okay? Inflammation interacts with the immune system. I meant to say, if anyone wants to take pictures and I moved on, just tell me to go back. Say, hold up, go back. So, energy, right? Oxidation, imbalances, mitochondriopathy. We're going to talk about this, but we want to make sure you have adequate energy. Biotransformation and elimination, big fancy word for we want to make sure the liver's working well, we're detoxing well, all our detox pathways are working effectively. We are in a world that we're constantly surrounded by toxins, 24/7, whether you know it or not, right? This beautiful furniture, probably when we first got it, right? Nice and beautiful, it's emitting and off-gassing all sorts of chemicals, right? We have nothing, there's no way to get away from it other than making sure that we are taking care of our body and we're doing everything in our power to detoxify. I love my little Sophie. Brand new, so happy, so excited. We get her a brand new bed. I had to tear that thing open. Of course, we got to get the really nice bed so that if she lays face down, she can breathe in it and my wife doesn't freak out and I don't freak out. And I open it up and I can just smell the toxins on it. I had to keep it. I wouldn't let her lay on it for a week. I said, nope, it needs to off gas. We are not putting her on that. So even me, I know what I'm doing here. And even me, I'm exposing my little beautiful Sophie to toxins, right? So even I make mistakes and we're surrounded 24/7, okay? Now granted, we made sure we got the good eco-friendly and all, but still, all that being said, communication, right? Not only communication from me to my patients, but hormonal and neurotransmitters. Make sure the hormones are communicating and expressing appropriately. Neurotransmitters, making sure your brain is communicating to your body appropriately, right? We want to make sure we assess this. Transport, so circulation, making sure we're having appropriate circulation. Blood pressure is crucial to heart health. Blood pressure is crucial to delivering nutrients to the body. And structural integrity. Basically, this just basically means that our blood-brain barrier, our lung barrier, our nervous system, our barrier in our nervous system, our barrier in our gut, these are our barrier in our bladder, these are all holding up to healthy integrity. So those are kind of just the pillars. So in functional medicine, if you do not have a functional medicine provider, that this is at least maybe in the background of their mind, they're not doing their job. This should be at the forefront of every functional medicine provider in some way. They should be assessing this or have some way to assess this and think of this. So again, this should just give you reassurance. If I go to a functional medicine provider who knows what he's doing, we're covering all of these pillars. At some point, maybe not right away, right? Maybe pillar 1 and 5 is really important, but at some point these all should be covered. All right, so can you tell the difference? I can't tell you how many times I've had patients come in and go, oh yeah, I see my PCP, they run my blood work. I'm like, oh, can I see it? Every time. CMP, complete metabolic panel, CBC, complete blood count. That's their blood work. Okay, you did good. How about we run our blood work? A little different? Right? I know you can't see all this, but there's a reason to that, because we do run an extensive panel. We want to I tell my patients we're going to turn over every rock and leave no rock unturned. We need to connect the systems. We need to make sure each biological system is working correct with another. If you want to ask me what this all is afterwards, we can. I promise you, if I were to go over it now, every single one of you will fall asleep. Okay? But again, can you see the difference? CBC, CMP. That's what you're going to get, because that's what insurance covers. Okay? Now, does insurance cover this? I tell my patients, yes, depending on your plan. But I can promise you, your MD runs this. If they run this, their pharmacy, their insurance manager for the practice will say, I'm getting calls from the insurance providers. They're going to review our insurance plan, and now we're at risk for our insurance plan being removed, and now I can't see Blue Cross Blue Shield patients, right? Because they are shackled down by the insurance companies. Okay? And I'll talk about this more in detail in just a minute. But again, what your PCP runs, some of what we run, some. This isn't even all of it. Okay? Okay, so have the end in mind, right? I always tell my patients, if you're running a race, if I have a race that I need to run, I need to know how long that race is going to be. I need to know what my path is, how many hills am I going up, how many downhills am I going down. We need to have the end in mind. If you don't have the end in mind, how are you going to get there? So this is what I imagine what my end would be in mind, right? I would love to be this lady. That's awesome, right? But like I said earlier, right? I want to exercise. I want to be able to exercise and move. If I can't, all right, I at least want to be able to interact with my family. I want to connect, right? We as humans were put on this planet to connect with other people, right? That is our life force. That's our energy, okay? Connection, human connection. And absolutely, do I want to hold my years down the line, great-great-grandchild. I would love that. I would absolutely love that. And I think most people would love that, right? So the end in mind, what's the end in mind? I want to move. I want to be able to connect. And I want to know my family. I want to be able to be around for my family, right? So I feel like that's pretty universal, okay? So now that we have the end in mind, now we know we have a game plan. How do we get there, okay? So we'll go to the hot topic. You don't take insurance, or insurance doesn't take us in functional medicine, okay? So, to insure or not to insure. So, before I go over some of the stats here, Insurance is what dictates conventional medicine, okay? Insurance basically approves what doctors can run and cannot run. That's why that panel, that CBC and CMP, is traditionally what's always run. Because if medical doctors start ordering very intensive panels without sending them to the ologist, the different ologist, insurance comes after them and says, hey, you're a primary care provider. It's not under your scope to be running these extensive panels. You're running up the insurance bill. You're practicing extensive care, which is this case does not determine it. We're now going to put your clinic under review, and you can no longer see these insurance patients until you're cleared. So again, if that provider's clientele or patients are 70% Aetna, now he loses 70% of his patients. And that's close the door, turn off the lights, you're no longer practicing. So it's unfortunately very fear-based model where everyone's got to keep their door open, right? But the most important thing is I always will tell my patients, I do not want finances to dictate the care that you deserve and that I want to give you, right? So that's kind of the big issue there. And so if we go back, if functional medicine provider goes into the insurance-based model, we're now back to that same fork in the road, right? We're now back into insurance dictates how I can treat my patient. We know that conventional medicine is not very successful at chronic disease, and we're right back at square one where they tell us what we can run and can't run, and we know we're in a system that does not have a good success rate for chronic disease. So, to insure or not to insure? So insurance, here's some of the pivotal points on why we do not do insurance. Insurance is based on a sick care model, not a healthcare or wellness model for reimbursement. So they only reimburse for sick, for illness. They do not reimburse for wellness. Now they're starting to at least do, like, I'm sure your insurance will give you a credit if you go and get a lipid panel done or if you go and get your blood pressure checked. They're starting to do that, but as a whole, it is it's a long ways away. Insurance dictates patient care and treatment options. Again, I think I've kind of hounded that into you. Insurance dictates your care, not your primary provider. Your primary provider has great intention, but they are handcuffed on what insurance will approve. The primary care provider, an insurance-based model, only has 7 minutes or less to see a patient to keep their doors open. Do you think you can get to the root cause of the issue in 7 minutes? I've been practicing this for many years. I can tell you I can't. I can't in 7 minutes. And I would like to consider myself an intelligent person. I know there's a lot more, there's a plethora of practitioners out there who are smarter than I am. I can tell you there's very few practitioners who someone has come in and who has had symptoms as I am tall for 20 years that can figure out what's been going on in 7 minutes. Not going to happen. I will put my licensure on that. Less than 2% of insurance is spent on preventative care. Again, insurance is not based on lifespan or lifespan. It's just based on health span. It's not based on health span. It's based on lifespan. They just want you to live long. They don't care if that length of living is healthy, okay? 50% of patients, now I go get insured. I got insurance. Great. 50% of patients are underinsured. So great, you put all that money in insurance. I don't blame you for doing it. My wife has our child under the insurance, which I tell her it's a waste. You come see me, I take care of you. But anyways, that's a me issue. But that being said, 50% of Americans are underinsured, and 1 in 4 Americans cannot afford their prescription medication. They reach their formulary. They give you X amount to spend on your medication, and as soon as you hit that, now you're out of pocket. So again, it's like, why am I dumping $1,000, $2,000 a month into my insurance plan? So that's one of the pieces. So again, but why? Why is this the case? Okay, why is insurance so expensive? Why are there so many issues with insurance? So one of the things here is, great, insurance is supposed to help us. At the end of the day, insurance is a for-profit business, right? They are for money. They are big business. Big business means big money. Big money means you have shareholders that you need to keep happy, and you need to make sure our stock looks good on Wall Street. I know it sounds very harsh. At the end of the day, that's the premise. So the big thing that we're seeing here is that as of recent is called a PBM, okay? Pharmacy Benefit Managers. These were individual entities that were hired by the states to regulate Big Pharma and not let Big Pharma put out a medication and say, hey, you got to pay an astronomical fee. PBAs were originally established to go to Big Pharma and negotiate an amicable price. But what ended up happening was these PBAs would go to Big Pharma and they would say, hey, listen, this is going to be the price. I want this percentage of kickback. So kickback, or this insurance company is not going to cover you. So, for example, they'd come in. Insulin was, when it first came out, was about $140. I'm not going to have the exact number, $140 a vial. Okay, the insurance, the pharma would get $140. They would have revenue for each vial they sold of $140. It is now around $120, somewhere around there. Why the drop in price? Has insulin gone down? No. It's because the PBAs negotiated that $20 goes to them, right? And so that's kind of how it's snowballed. But these PBMs, basically what insurance then did is said, okay, well, let's go and buy the PBMs. So all the PBMs, now these individual entities that were supposed to be separate and help keep the price down for us Americans, now they're going in and buying out these PBAs so that they can control the whole kit and caboodle. So here are some actual stats here that are pretty kind of eye-opening. The 3 insurers of PBMs, okay, Cigna, Aetna, United Healthcare, control 80% of pharmacy benefit market. So they control 80% of these PBMs. So that means they can dictate the price and they can dictate the kickback. Cigna and CVS now get more revenue than their PBMs, than their health plans. So basically, the insurance is they're controlling these percentages so much that they're now, these insurers are now getting more than the PBMs. The big 7 for-profit control, again, 69% of Medicare Advantage market, 85% of all new Medicare Advantage enrollments went for-profit insurers in 2022, 99.3% United Health enrollment growth has been in government programs over the past 10 years. So if government is involved, there's going to be some issues, right? The big 7 for-profit health insurers made $43.8 billion in profit. That's pretty staggering. They took in $620 billion in revenue, much from the taxpayers, and then 53% of all Medicaid beneficiaries are now enrolled in health plans managed by the big 7, which control the majority of the PBMs. But again, there's a lot of stats on here. I don't want to bore you. Just know, why is insurance so expensive? Why haven't we corrected this? Is because of these PBMs that are controlled by the insurance companies. Again, cost for insurance. Okay, again, kind of just tying in the PBMs. We can see here 2011 single payer packages, right? Just basically shy of 5,500. Family coverage packages, just a little over 1,500 in 2011. 2021, we can see, almost a $3,000 bump. We can see almost, roughly $7,000, $8,000 bump, right? Insurance is becoming more expensive. Why? Why is that the case? Because PBMs are basically being mismanaged, and insurance is getting involved with the PBMs, driving up the cost. Okay? But again, this is just a slide just to show you that insurance is getting more expensive. Insurance is typically not going to be the best model, and it's not going to be the cheapest, in some cases not the cheapest model. All right, so therapies of healthy aging. How do we get to that goal of health span, healthily aging? Guys, I know it sounds trite, but it's easy. It's not. I like to tell myself that I don't always have the most complicated job. I tend to make it overcomplicated. It's easy. Just applying it day in, day out is hard. That is hard. Knowing what to do is easy. The application is a whole nother ballgame. It's a grind. It's a grind to be healthy. If it was easy to be healthy, we'd have no disease. We'd be the healthiest species on the planet, right? But it's exercise, proper sleep management, proper nutrition. The one that we miss the most, that's probably the hardest one, stress management, right? We're constantly caught in the rat race, right? Constantly keeping up with the Joneses, right? I admit, right? Here I am, on my evening, my wife's at home with probably Sophie screaming her head off right now, and she's probably looking at the clock, counting the seconds till I come home and she can hand the baby over to me, right? So again, it's easy in theory. Implementing this and staying consistent with this, whole nother ballgame. So, deeper dive into healthy aging, right? So we take care of sleep, we take care of nutrition, we take care of stress management, we take care of exercise. Now we get into a deeper dive, right? We talked about the gut, seeing how we are absorbing and assimilating our nutrients. Kind of tied into the gut here is bacteria. Do we have any type of infection? Are we dealing with any type of pathogen? Our endocrine system, so all of our hormones, our thyroid, our adrenals, our sex hormones, tie into our overall health. And then, as we talked about earlier, constantly being surrounded by toxins, right? We are in a toxic environment, whether we like it or not. Are we eliminating that, right? So now we got exercise, sleep management, nutrition, stress management, right? That's the top pillar. Okay, now we take care of that. What's the next step, right? Next step, healthy gut. Take care of any pathogen. Make sure our endocrine system's working well. Making sure we're eliminating toxins. Easy, right? Easy. Sometimes. Okay, so some testing. What can we do? Yes, we can run blood work. Some additional testing. This is really, really cool. It's not the cheapest test. If you want to talk to me about pricing, I can talk to you about this. But it's a little bit, to me, it's a little scary, because this test, they can tell your epigenetic biological age. So from a cellular level, what's your age from a cellular level? I'd like to think, I haven't run this yet. I want to. I haven't run it yet on myself, but I'd like to think my age is 34. Okay, I know I look nice and young for my age. Thank you, everyone. But I'd like to think my cellular age is 18. Right? That's what this can tell you. Right? There's our chronological age, and there's our cellular age. So that's really, really cool. Your telomere length. So again, your gene expression, right? This is how I kind of talk about this. So what are your telomeres? We have the little, everyone knows like the little plastic end of your shoelace, how it has that cap on it, right? That's your telomere, okay? And we all know after we've worn a pair of shoes for a good while, that plastic cap starts to get frayed and the shoelace starts to kind of fray as well with it, right? That is DNA methylation. That is aging. That is happening in all of us. Unfortunately, it's happening to me right now, right? But that can tell us our telomere length, which can give us an indication on your cellular age again, right? The Duden pace, this is basically, again, this is where it gets a little bit eerie. Another name for this is called your Grimm age. Your Grimm age. And they can, due to your cellular function, due to your telomere length and biological age, they can basically determine, it's a speedometer for your current rate of aging. So basically, how soon you shall expire. I don't know about that. But it's interesting. So this is the true diagnostic testing. So this is, if again, we're talking about this whole concept of healthy aging, health span, this is very interesting. Okay, so we mentioned that, right? We mentioned that telomere length and that biological age, right? What determines that? DNA methylation. I am not going to dive into a boring sonnet about this. I'll quickly hit some key points. But think about DNA methylation expresses or turns off a gene, okay? So we can methylate, which can turn on certain expressions, or we can demethylate or inhibit DNA methylation, and it can cause us to age faster. So again, DNA methylation, loss of protein homeostasis, age-related mitochondriopathy, stem cell exhaustion, immunosenescence. So we want to see if we can help regulate DNA methylation. What does this result in, right? If we're not methylating appropriately, poor sleep. What can affect DNA methylation negatively? Poor sleep, alcohol, not enough exercise, stress, human isolation, not meditating, unhealthy gut, right? The things that we've already talked about already, right? These can affect how we methylate and how we express our genes. So improving methylation, again, this is some take-home notes. If you want to take a picture of this, go right ahead. I wanted to give you a little bit of information. How can I just, other than what I've already talked about, improve my DNA methylation? Here are some great nutraceuticals and herbs that are connected with healthy DNA methylation. Okay, I will not read through all of these because I will be the epitome of presenters that I hate. But just know these are all healthy herbs and nutraceuticals. Now, you don't need to use all of them, but absolutely zinc, vitamin D, those are must-haves. Curcumin, that's typically a must-have from myself. Resveratrol and quercetin, I use those on a daily basis. But my love is vitamin D. Every single cell in the body needs vitamin D. So, I don't want to take a pill. Okay, I'm fine with that. I want our food to be our medicine. That's first and foremost, right? Hippocrates said, let thy food be thy medicine, right? So here are some of those herbs that help with DNA methylation. And look at this. It's in our food. Fruits and vegetables, right? For your anthocyanin, your apigenin, fruits and vegetables. Your catechins, fruits and vegetables are high in catechins. Chlorogenic acid, fruits and vegetables that are high in that. So let's eat our medicine, right? Kind of weird when thinking about it. But so if anyone wants to take pictures, feel free. Tell me to get my ugly mug out of the way. I'll do that. But I thought that's a really nice one. Again, I want you to be able to take home something, right? So that's a nice slide. And if anyone needs me to go back, just yell at me. 5, 4, 3, 2, 1, gone. Okay, next, food, right? Again, medicine. Okay, so I really like this one because everyone knows when you go to your MD talks about I can tell you they'll be referencing, if they even talk about nutrition, which majority of the times they won't, but if they know a little bit about nutrition with the maybe 3 credits that they've taken out of the 180 credits, is a DASH diet. That is a very, very old diet. I think this diet goes back to maybe even the 80s. Basically, what a DASH diet is based around, you can kind of think of it as your food pyramid, right? The bottom layer being like your grains, the next layer being your dairy and your protein, and then that next layer being like your sugars, your sweets, things like that, right? Everyone can remember that food pyramid, and that's what your DASH diet is. So, okay, yes, we can reduce our biological clock somewhat with that, but you can see here with a great Mediterranean diet, lots of seafood, lots of healthy oil, lots of good vegetables, that we can reduce our biological aging 0.23, so almost double, right? And here's another beautiful piece here, calorie restriction. So there's a lot of evidence and information coming out on fasting mimicking diet or a modified fast in reversing or preventing and slowing down dementia and Alzheimer's. Everyone know, maybe not, but the character Thor, I think it's Chris Hemsworth. I'm not the biggest person with, I'm not even blanking on it. That's how much TV I watch. But it's Thor, the big dude, Chris Hemsworth. He has an ApoE44, which means he has an 80% risk of developing Alzheimer's. He put on a big docu-series, which is great. I loved it. And one of the episodes was dedicated to an extended fast and all the research on how, clearing out what's called zombie cells, clearing out these senescent cells, increasing cellular autophagy. These are all big, fancy, fun words, basically to mean that it helps prevent dementia. So again, just the fact that calorie restriction. Now again, do I need to starve myself? No, by reducing an intake of roughly 11%, they saw a reduction in biological clock by 0.41. So even better than our nutrition, right? I'm not saying go out there and starve yourself, but it brings a little bit of awareness of maybe I should implement some modified fast, or maybe an extended fast once a quarter, right? Where 48 hours, 72 hours, I'm not eating anything. I know that seems daunting, but once a quarter, twice a year, the research is very strong. Okay, stress and aging. So DNA damage clock here. So I'm going to basically break this down. So almost a quarter of DNA damage are found in glucocorticoid response. What does this mean? It means that we can damage our DNA, we can decrease our aging by increasing glucocorticoids, cortisol, stress hormone, right? So we don't want cortisol super high, we don't want it super low, we want the Goldilocks principle, not too hot, not too cold, but chronic stress is going to cause DNA damage. Cumulative life stress associated with the cellular aging of the methylome, right? That DNA methylation that we talked about. Stress increases inhibited DNA methylation. Drugs, dexamethasone, glucocorticosteroids, advances DNA damage. So certain medications inhibit our ability to be healthy over long term. Okay, so there's a lot on here. What I want you to draw your eyes to is exploring epigenetic age in response to intensive relaxation training. Relaxation. Stop the rat race, right? I have to tell myself that too. Stop the rat race. Let's try and relax, right? Our findings would suggest that intensive relaxation practices influence different aging molecular mechanisms by reducing DNA damage and increasing leukocyte telomere length and telomerase, right? Increasing those plastic caps on your shoelace, okay? So again, this is just so important. I would say the majority of my patients that we need to focus on is how do we incorporate relaxation? How do we incorporate de-stressing? It's very hard. It's very hard. I'm telling you, it really is. But we need to work on it. Exercise. So the first time I presented this, someone said, 450 minutes a week? So I broke it down. It's a little bit over 60 minutes a week, okay? But it's movement, it's activity, it's getting off our dairy air and getting outside, right? You don't have to go and do 450 minutes of CrossFit every day, right? Just let's get outside, let's get moving, get your respiratory rate up, contract and relax the muscles, right? 450 minutes per week, okay? Even better, team sport. Well, even if it's shuffleboard, badminton, just getting out and getting involved in team sport may be better in extending life expectancy. I think not only is the team sport, it's because you're interacting with other people. Again, we're connecting. We're connecting. Why were we put on this earth? To connect with people, okay? This one here, we talked about sleep, epigenetic aging and immune senescence in women with insomnia. So again, we're just driving home these points of what can extend health span, right? So insomnia symptoms related to advanced epigenetic aging, right? Again, just think about that plastic cap being broken down. So symptoms of insomnia were associated again with increased epigenetic aging. So basically patients who had more insomnia symptoms, who did not sleep as effectively, aged faster. Okay, so some benefits here to increasing microbes to support methylation. Again, I want to try and give you some things that you can take. So folate-producing bacterial species. I'm not going to name every single one of these because I will butcher them and look like a moron, but these are all healthy probiotics, healthy, rich probiotics, right? Okay, so these are things that we can do, right? Lactobacillus plantarum is a great one. Bifidobacter longum is another really good one that we use a lot. So what we have in our gut, how we feed our gut influences how we age, influences how we methylate. Here are just some healthy, just some other tips. Again, just some like, hey, you could try this or at least get some information on this. I don't expect you to take this, but again, I want to give you some at-home tips that if you go to your PCP and you go, hey, doc, how do I stop aging? He's going to look at you with 10 heads and go, we can't do that, right? We're all going to age, but we have mechanisms to help slow down the speed of aging. To be honest, we really do. I know that sounds very far-fetched, but medicine has gotten to a point that we are able to slow down the process, right? And here are some fun things that I like to mention. So we have when we talk about slowing down aging, we're talking about mitochondria, okay? Enhancing and improving mitochondrial function. So nicotinamide riboside, nucleotide adenine dinucleotide, nicotinamide mononucleotide. Yes, I practiced those for 2 hours before I came in. No, no. These are just molecules that basically feed your mitochondria. Mitochondria are the powerhouse of our body. They produce our energy, they produce our ATP, they help with our DNA. So a lot of research is being put into mitochondrial function and helping with aging. So this is something called True Nitrogen, something that we carry. It's one of my favorites. Here are some new products that we're getting into. Dr. Turnpaw just brought these on. This company is very, very reputable. It comes with a price, though, I will say that. I don't usually give this to everyone, but because the reason why is because the pharmacy or the nutrition company that we use, they use what's all called white label studies. So all the nutraceuticals in these supplements are backed by white papers, meaning if it were to go to court, it could hold up in a court of law. That's pretty profound in the supplement world. But these are just things that can help reduce or slow down the process of aging, help improve cognitive function. I'm not going to read through all of these, but this is something called Prime Time. It has some of the herbs. I don't have enough time, nor would I want to bore you going into each herb and why we're using it. But again, epigenetic aging, right? You guys are pros in that term now. So boosting autophagy, which is kind of like the clean sweeper going by and repairing the body. Here's just another product, Telomere Prime. Again, I'm not going to go over all of this here, but if you wanted to take a quick snapshot, you could understand. Basically, again, this is helping clean up some senescent cells, helping downregulate inflammatory process, and improving cognitive function. Does anyone want to take a picture? We're good. This is Rejuvenate. This is one of my favorite ones, especially for patients who are really, really chronically sick and they can't get out of this, what we call sick cycle. It's really, really helpful. You can see all the things that's beneficial. But again, my goal was just to give you a little take home, and so you could at least maybe look this up on your own, or it's not, you don't have to get it through us. But again, I just wanted to give you a little bit of information. This is something I'll talk about quickly. This is called a prodrome scan. So this assesses your level of plasmalogens. Yes, that is the price for it. Okay, right? Not cheap, but in regards to dementia, in regards to cognitive issues, right? This is I mark my words. 5 years from now, you're like, oh yeah, I remember this doc was talking, crazy doc, but he was talking about this plasmalogens. It will be that cutting edge. Okay, so what is the prodrome scan? What is a plasmalogen, right? Plasmalogens are essential molecules for cells in our bodies. These are vital roles in brain health. That's the big one. Heart, lungs, kidneys, and eyes. As we increase in age, we will decrease your quantity of plasmalogens. Studies show decrease in these molecules may be related to symptoms of brain disease. Plasmalogens are naturally inside us. You can reset. We can bring these plasmalogen levels back up. Again, this is just wanted to mention they're essential for nerve cells, right? The big thing here is several scientific studies show plasmalogen levels are low in people with neurodegenerative disease, dementia, Parkinson's, MS, right? And then there's some other issues that can be connected with low plasmalogen levels. This is just a study that showed with plasmalogen levels, 95, basically age 95, who had high levels of plasmalogen were able to have the same chance of living another 5 years as their counterpart of 65 years of age with low levels of plasmalogens. So again, pretty profound here. Someone who's much significantly older has the same percentage of living 5 years as their counterpart at 65 with low levels. That's it. I think I got through that. I ran a little bit over, but I don't know, get all